She didn't really like good support.
Oh, do we have, yes, yes.
I don't think it's gonna be in my way. So I was doing the pudding. I believe it's standing here, but right where the tape is.
Yeah.
Right, yeah. So you're asking about those handicapped.
Let me, so they don't have their phones with them.
I've got so many, they could take one with them.
Okay, okay.
These little QR codes, yeah, I usually kind of like go around and have them scan it, but they can take one. It's fine. Yeah, they can have, there's a few back there too as well. Definitely turn it on regularly.
Welcome, everyone. Thank you for joining us today. This is a really monumental opportunity for our doctoral students. Very few nurses have a doctoral degree. So you are in elite company today with your students, your family members, and we are so proud of each and every one of you and your hard work and dedication to get to this point in your academic pursuit. So we are here to do a hooding. And as the students know, it takes a lot to get to this point. Their projects, their endless hours, and it takes a lot of support. So we are thrilled that you could make it with us today here in New Orleans, and thank you for coming from the church over to here. It's a lot cooler over here than it was outside on the way over, so welcome. So Dean Collins, if you'd like to come and make some welcoming remarks.
Welcome, everybody. Thank you for joining us, and thank you, Dr. Burke, for the introduction. Thank you to all of us who've joined in person and those on live stream, watching from home, to celebrate the hooding of Loyola's Doctor of Nursing Practice graduates, or DNP, as we all call it. Today, 11 DNP students will receive their academic hoods. I don't think everybody's here, but 11 will receive their hoods. The 11 students come from 9 different states and are joining only 1.2% of registered nurses in the country who have earned a Doctor of Nursing Practice degree. The demand for nurses with advanced degrees has never been greater. We work clinically as nurse practitioners, nurse educators, nurse anesthetists, nurse midwives, and clinical nurse specialists. We start, then manage our own clinics and practices. We serve in executive positions in healthcare systems and educational institutions, and work in government leadership. Never has it been a more exciting or challenging time to be a nurse. In the midst of a critical nursing shortage predicted to only worsen over the next 10 years, these graduates have committed themselves to improving the health systems in which they work, using research to enhance the lives of their patients and educating the next generation of nurses. After reading in your programs the impressive project work that these graduates have done, I think you'll agree with me that the future of healthcare is in very good hands. Congratulations again, and Dr. Burke, I'll turn it back to you.
Thank you, Dean Collins. So the insight and the reflection, 1.2% of all nurses are doctorately prepared, have a DNP. That really just gives you a moment to pause and realize we're in elite company today. I'd like now to invite Dr. Melissa LeBron, the director of the Family Nurse Practitioner Program, to explain the symbolism of the doctoral regalia and the hood. Dr. LeBron.
Hello, everyone. Academic gowns and hats make up a custom that dates back to the Middle Ages. The most symbolic part of the academic gown is the hood. With modest beginnings as head-warming cowls on medieval monks' cloaks, hoods today communicate the wearer's school, degree, field of study through their length, and the colors of the lining and the binding. Although there are bachelor degree hoods, many institutions, including Loyola University New Orleans, reserve the wearing of the hoods for graduate degrees only. Each successively higher degree carries with it a longer hood. The color of its velvet border indicates the academic field, and it is lined with the color or colors of the institution granting the degree. Today, as candidates for the degree of the Doctor of Nursing Practice from Loyola University New Orleans, you will receive hoods bordered with apricot velvet, the color for the field of nursing, and lined in maroon and gold, the colors of the university. We wear our regalia and our colors proudly. They are symbols of your hard work, academic achievement, and your affiliation with the university. Thank you. Dr. Burke?
So today, as candidates for the degree of Doctor of Nursing Practice from Loyola, New Orleans, you'll receive your bordered apricot velvet to designate that you have a Doctor of Nursing Practice. So we're going to have the hooding. Dean Collins, will you please join me on stage and announce the candidates that I'll be hooding? Today, I'm going to be hooding Dr. Kim Brannigan's candidates due to the fact that her daughter is also graduating today. So when I call your name, please come.
David Davis. The title of this project is Reducing Pediatric Restraint Use by Increasing Nurse Perceived Competency Following an Evidence-Based Policy and Practice Bundle Implementation. Dr. Davis. Scott Williams. Scott's project, Eliminating Central Line Associated Bloodstream Infections in an Adult Intensive Care Unit. Dr. Williams. And then Dr. Burke, Will Hood, Lana Harrison. The title of her project, A Quality Improvement Initiative to Increase Adherence to the ICU Liberation Bundle in a Community. Dr. Harrison.
Now I'd like to ask Dr. Emily Eisworth to please join us on stage. The first person that we would like to recognize was unable to attend today, Yahaira Cardenas Velasquez, whose scholarly project was the utilization of glucose self-monitoring among Mexican-American patients with type 2 diabetes mellitus. Let's join in for a round of applause. Congratulations, Dr. Cardenas Velasquez. The next recipient of the hood is Maria Mahalko. Dr. Maria Mahalko was unable to attend today. Her scholarly project is Improving Human Papillomavirus Vaccine Rates in Primary Care, a quality improvement project. Congratulations, Dr. Mahalko. Next, I'd like to invite Carnisha Murphy. Carnisha Murphy's scholarly project was Standardizing Effective Endocarditis Treatment, a quality improvement project. Congratulations, Dr. Murphy. Next, I'd like to invite Dr. Michelle Ellis to come hood her students. The first student that could not be with us today is Tara Fuller. Dr. Tara Fuller's scholarly project was cardiac risk assessment prior to psychotropic initiation in the outpatient psychiatric setting. Let's congratulate Dr. Fuller. Teresa McGuire. Dr. McGuire's scholarly project was increasing influenza vaccination rates in adult hospitalized mental health patients. Congratulations, Dr. McGuire.
No, the degree didn't strangle me.
I'd like to also announce Joanne Wortham. Her scholarly project was the effect of evidence-based discharge against medical advice, DAMA, protocol on DAMA readmission rates. Dr. Wortham. I would like to invite Dr. Antiqua Smart to the stage, please. And I'd like to invite Yolanda McKinney to join us. Yolanda's project is implementing a DASH diet patient education program as an intervention to improve hypertension management among low-income African-American adults in underserved community clinic. Congratulations, Yolanda. Next, I'd like to invite Victor Zindoga to the stage. Victor's scholarly project was improving breast cancer screening in primary care. Congratulations, Dr. Zindoga. You all look marvelous in those hoods. You really, really do. I would now like to invite all the candidates and the faculty to please join me on stage for a group photo. Candidates, if you'll stay on the carpet, and faculty on the top. Dean, also join us.
There we go. All right, everybody.
Thank you, everyone, for this. So we know that you all have come from near and far to celebrate our graduates. We know that they're going to go out near and far and make a difference in nursing. We're so proud and so honored to have them go out and be Loyola Doctorate in Nursing Practice graduates. Well, that concludes our presentation, our hooding ceremony. We hope that you have a lovely night in New Orleans and that you'll be joining us tomorrow morning for graduation. You know, we have a wonderful keynote speaker, John Baptiste, and we hear he's going to play the piano. So if you weren't planning on coming, you better come. So thank you all so much. Congratulations, graduates. Everyone, please, we have lots of time. Feel free to come up and take pictures with your graduate, family, whatever, in front of the flags and everything. Yes, the banners.
Yeah, she can.